I'm Alan Goldstein. I'm the Chief of the Division of Pediatric Surgery at Mass General Hospital for Children. In addition to clinical pediatric surgery, I also spend a large percentage of my time doing basic science and clinical research. When I was training to become a pediatric surgeon, I met a young patient whose intestine did not work at all. It's a condition called pseudo-obstruction. She was unable to eat anything by mouth since her intestine could not push nutrients along. Her abdomen was quite distended. She needed multiple operations. I was very frustrated because I came to the realization that nobody knew how to help her. And it made me realize how little we know about the intestine, about its motility and how it functions. And that's how I became interested in the area that I research now. My main focus of research for over 10 years now at Mass General has been a disease called Hirschsprung's disease.
My name's Jamie Mardus, and my son Jack will be, he's 3.5. He'll be 3.5.
Roth Reason from Danville, Pennsylvania. This is my wife, Gabriella.
And our son Phineas is almost 2.
My name's Tori Houston. My son Avery will be 3 in December.
Jack was diagnosed at 1 day old and had his colostomy at 14 or 16 days old, and then his first pull through at 4 months.
I want to say the official diagnosis came in at age 14 days, and at 20 days old he had an 8-hour surgical procedure for biopsying, and then it was too long for him to be under, so they had to go in again at 22 days old and give him an ileostomy, and he had his pull through at 9.5 months old.
Hirschsprung's disease is treated with an operation called a pull-through procedure. That's the most common procedure done for this disease. It involves removing the part of the intestine that has no nerve cells and pulling down the part of the intestine that does and sewing it to the anus.
Phineas was taken to the NICU at a day old and then diagnosed at age 10 or day 10, and then he had the surgery for the colostomy and then pull-through surgery at 5 months.
Hirschsprung's is an interesting disease. It's the absence of nerve cells in the lower part of the intestine, specifically in the colon. Children that are born with Hirschsprung's disease are unable to pass stool, and many of these babies can't have a bowel movement at all until the surgeon intervenes.
So I have so many patients that unfortunately can't eat by mouth, and that is because their intestine doesn't move properly, or because it hurts, or there's other difficult sensations like very bad nausea and vomiting. And we now are starting to understand that many of these cases are because the nerves of the intestine have become damaged. I have this dream, and I think I share this dream with other people in our lab and in other labs across the world, where we can cure these diseases. We have cells in different animal models, when you see them in the petri dish, become neurons and they reconnect. And we are hoping that if we can place these cells into the right diseases and the right hosts, they will repair the neurons that have been damaged. There's a lot of questions that are still left unanswered. What is the right dosage of these cells? How should we treat them? How should we implant them? What is the best way that we can make them take and not be rejected? Will they integrate to the underlying circuitry? Will they become damaged again in the future? Many, many questions arise. However, we are confident that we are beginning to see the light, and that new pathways and new treatments will soon emerge.
The nerve cells of the intestine are just like the nerve cells in the brain. They control everything. For the intestine, the nerve cells control how much fluid the intestine secretes, how it absorbs nutrients. They control the type of bacteria that live in the intestine and the immune function of the intestine. So you can imagine the problems caused in an intestine where some of the nerve cells don't form, where part of the intestine completely lacks them. All of these projects, I hope, will one day not only enhance our ability to understand Hirschsprung's disease, but lead to new cures so that the lives of children with Hirschsprung's disease can be significantly improved through the work that we and other labs throughout the world are doing.
These cells, which can give rise to new neurons and the supporting glial cells, have one added capacity. They are able to find their way into the desired organ through an ability called homing. Other stem cells share this homing capacity. Through receptors, they can find their way through the bloodstream and reach the organ that they're intended to reach. In our case, it would be the intestine. If this is clinically feasible, even a simple peripheral blood injection of the cells would allow them to migrate through the bloodstream, enter the intestine, replace the damaged neurons, integrate with the underlying neural circuitry, and within a few weeks, the patient could be back to eating.
It's estimated that a third to a half of all children will continue to need medications to manage severe constipation or to manage diarrhea or fecal incontinence. It's also known that about 30 to 50% of these kids will experience episodes of enterocolitis. Enterocolitis is the most serious complication of Hirschsprung's disease. It represents a severe inflammation and infection of the colon. We don't know why it happens, but we do know that it causes severe morbidity. Up to 1 or 2% of children will die from enterocolitis. That number used to be much higher, up to 30% back in the 1960s. Fortunately, with improvements in critical care, in antibiotics, and better recognition of the disease, we've been able to bring that number down, but it's still not zero.
We were talking earlier, and she says, "I don't call my pediatrician for anything now. I just
Oh,
call
no.
Dr. Goldstein."
Mass General has a wonderful ER, but even a couple of times that we went into the ER with what I knew to be enterocolitis, I would call Dr. Goldstein and be like, "I'm coming into the ER, and I know it's enterocolitis. Just, do what you have to
Meet me
do." And he has.
Yeah.
He's come down to the ER and been like, "All right, this is this is that." Get things going and admit them.
What drives my passion every day in the lab is to try to understand what is the problem, and once we understand the problem, hopefully we can figure out a solution.